Well, it's open enrollment season for millions of Americans, but how do they choose what kind of health care plan that they want? According to a new survey by Empower Research, cost is the biggest factor for millions of Americans, with 53% of them, that's more than half, saying that it is their primary driver. The survey also reports that nearly half of Americans say they would make a different decision about their health care benefits if they had a better understanding of the options, with more than a third of respondents saying the whole process is overwhelming. So here to help us once again is Dr. Natasha Bhuyan, National Medical Director for One Medical. All right, again, daunting, overwhelming. So where do you even begin when it's time to start choosing a health plan?
Yeah, absolutely. There are so many options. The best place to start is with yourself. So what I tell people is think about your needs. How much did you spend on healthcare last year? How much did you spend in total on healthcare the prior year? And then you can think about, do I want a plan that's a higher deductible or do I want a plan that's a higher premium? You know, are you going to access, do you have back pain and you know that you're going to need 12 sessions of physical therapy? Trying to plan for things like that is really critical. I think the other one, this is where it gets really confusing, is knowing which doctors are in network. So is your PCP in network? Are your specialists in network? You know, the instance comes up where sometimes a doctor accepts a certain plan from a specific insurance company, but not a different plan from the same insurance company. And I've seen my patients get really tripped up. So really understanding, you know, what is the coverage for your own specialists and your own doctors. Medication coverage is one that's becoming increasingly more important. So we think about GLP-1s. You know, the GLP-1s are really expensive. A lot of people are on them. If you don't have insurance coverage, it's over $1,000 a month. And so if you're going to spend $12,000 to $15,000 on GLP-1s, it might be smarter to opt for an insurance plan that might be more expensive with the premiums. But in the long run, if it's covering things like GLP-1s, you'll end up saving money. And then the last thing I tell people, this is really hard to do, but trying to predict what healthcare needs you're going to need. Now, the number one reason that people are hospitalized, it's actually for having a baby. And so if you're thinking about things like family planning, thinking about maternity and pediatric coverage is really important. Now, the thing is, most insurance plans will cover basic maternity coverage, but if you have a narrow network plan, if you go into the hospital to have a baby, if you end up getting, for example, an epidural, the anesthesiologist group might not be a network if your plan is really narrow.
Right, because there's multiple doctors and sometimes you don't know who takes what.
Exactly, and so if you know that you're gonna have a hospitalization or have a baby, you want a broader network plan so that way you don't end up getting a surprise medical bill. I've seen that happen many times.
Wow, I bet. Okay, so many times, I mean, it feels like we are just overrun with a bunch of letters, right? There's a lot of terms that we should know, so cut through the noise for us.
Yeah, and you know, I've heard just only 4% of people even understand the terms of their own insurance plan. So a couple of terms to know, it's really HMO and PPO. So HMO, these tend to be plans that are cheaper, so people like to choose them, but they have narrower networks. In order to see a specialist, you have to often get a referral from a primary care provider. And so these plans are good for people that are fairly healthy, that go to the doctor once a year. Their PCP can take care of all their specialist coverage. Low maintenance plans. If you have more healthcare needs, if you have specialists, if you have chronic conditions, it's better to choose a PPO plan. The other one that we're seeing more and more of is employers are offering high deductible health plans. And the reason they're doing that is you have a high deductible, a lower premium, but they're pairing it with other ways to pay for your healthcare coverage. So thinking about HSAs, FSAs, HRAs, I know those can get confusing. An HSA people are eligible for if they have a high deductible health plan. It's just a vehicle to pay for healthcare coverage. HSAs have really great tax benefits, and so you're able to access that money tax-free. For some people, that's the right option. The money rolls over every year, so some people use it as almost a vehicle for investment and growing. FSAs are a little different. The money doesn't roll over. It's really use it or lose it, but it's another way to pay for funds. And then HRAs are also different because only employers contribute to HRAs. So if you leave that job, if you think you're going to leave your job, that HRA is gone. So thinking about all those, and then the other important terms, coinsurance and copays. So knowing how much do I need to pay if I see a PCP, how much more do I need to pay every time I see a specialist, and then knowing what percentage of my medical bills, the coinsurance, will I be responsible for. I think diving into the details of that is important.
Okay. Well, thank you so much for cutting through the noise. It is a lot, but you know, just knowing a little bit about the basics makes a lot of people feel just a little bit better.
Exactly, and you know, a lot of people, I think more than 80% of people, they just auto-renew their plans because it's so daunting. overwhelming. They don't want to dive into the details, and I want people to feel empowered.
Those are some blind mistakes that could cost you big down the line.
Exactly. Yeah. Ask questions, talk to your PCP, feel empowered, so that way you truly understand the plan that you're signing up for. And that way, in the long run, you're not paying more for healthcare than you should be.
Absolutely. Natasha, thank you so much. We could have gone on for 20 more minutes, but over to Cam now.
Tram, tell Doc, we're just going to talk to her if we have any questions down there.
Seriously, I've got her on speed dial.
There we go.